The goal of aseptic hand washing is to protect you and your patients from infection and to prevent cross-contamination. Medical aseptic hand washing is a procedure you'll perform after patient care, specimen handling, using the toilet, or touching anything that could contaminate your hands. You should also perform aseptic hand washing when you arrive at work and before you leave, before and after you eat, and at the end of the day. Jewelry and wristwatches can carry microorganisms that could transmit an infection. Before beginning medical aseptic hand washing, remove all jewelry except a plain wedding band. Remove your wristwatch unless it can be pulled up above your wrist. Even though you're accustomed to washing your hands at home, there are important differences in medical aseptic hand washing. To avoid touching contaminated surfaces, turn on the faucet with a paper towel. Adjust the water temperature to lukewarm. Hot water can make your skin dry and chapped, compromising the first line of defense against infectious organisms. If this is the first hand wash of the day, use an orange stick to clean under every fingernail. Inspect your nails thoroughly. Wet your hands, apply soap, and lather all the way up to your wrists, using a circular motion and friction while holding your fingertips downward. Be sure to clean and rub well between your fingers to remove soil and contaminants. Rinse well, holding your hands with the fingers pointed downward. As the water flows toward your fingertips, soil and contaminants wash off your skin and down the drain. If this is the first hand wash of the day, or if your hands are obviously soiled, repeat the scrubbing procedure using a vigorous circular motion over the wrists and hands at least 1 to 2 minutes. It takes time for friction and motion to eliminate all possible soil and contaminants. Rinse your hands a second time, again keeping your fingers lower than your wrists. Without touching the dispenser, get a clean paper towel to dry your hands. If the faucets are not foot-operated, use a paper towel to turn the faucet handle to the off position. Dispose of the paper towel when you're finished. To eliminate possible sources of infection, always discard waste immediately in a covered container. If needed, apply a water-based antibacterial hand lotion. Keeping skin healthy and preventing dry, chapped skin provides a defense against microorganisms. An alcohol-based hand rub may substitute for hand washing unless the hands are visibly soiled. In fact, using an alcohol-based hand rub can be as effective as plain hand washing, even against nosocomial infections. Using antimicrobial impregnated wipes, such as towelettes, is, however, not a substitute for using an alcohol-based rub or an antimicrobial soap. Repeat medical aseptic hand washing throughout the day to eliminate contaminants and prevent transmission of pathogens to yourself and others.